القراطي استشاري جراحة عامة انو ريكتال سيرجري استاذ مساعد جامعة صنعاء استوبك hemorrhoid and hemorrhoidectomy and their relation to the sexual function. ان شاء الله نخرج بإجابة لهذا السؤال اللي دائما نتعرض له.
Thank you very much for inviting me to present this very interesting topic, the relation between the hemorrhoids and hemorrhoidectomy on sexual activity of Yemeni male patients. I have no disclosure. The aim of the study to study the effect of hemorrhoids and hemorrhoidectomy on the sexual activity of Yemeni male patients over 11 or 12 years. Our experience regarding this point of a relation between hemorrhoids and sexual activity is a matter of debate, and it's in first instance, the majority of patients coming to you at the clinic complaining of erectile dysfunction before hemorrhoids and before hemorrhoids to be discovered by the surgeon. They are complaining from erectile dysfunction and seeking this is the cause because of hemorrhoids. And please, doctor, manage the hemorrhoids to improve my sexual activity. And this is the point here in outpatient clinics all the time. Most adult men patients with hemorrhoids are seeking surgical treatments when they have erectile dysfunction or decreased sexual function in order to improve their sexual activity. As we know, we are nearby urology and colorectal surgery. We are sharing a lot of things. We are sharing anatomy. We are sharing the same neuronal supply, the same sensory, the same motor, the same autonomic nervous system, the same hypogastric neurons that supply this area, the same splanchnic neurons in the pelvis supplying the both sphincters, anal sphincter and urinary sphincter, and even urination, as we thought all the time, our medical students regarding the defecation reflex, also the same process will be in urination reflex. They are the same area. All the time we are talking here about this anatomy is a bit complicated in surgery to be understand. And if you look for this area, we'll find it is the same regarding the sphincter in the urology, regarding the internal sphincter and external sphincter. There is some theories regarding what's the cause of hemorrhoids in patients, either to be sliding theory, what's called sliding theory, or rectal redundancy or vascular abnormality. Professor Robin Phillips, this one, and this is Professor Nichols, both of them in St. Mark's Hospital, wrote a paper in 1994 regarding the etiology of hemorrhoids, either to be constipation or prolonged straining, the abnormal dilatation and distortion of vascular channel, or destructive changes in supporting connective tissue within the anal canal. Hemorrhoids are associated with regional, either to be vascular abnormality or anorectal pain and irritation. The vascular abnormalities regarding the cause of hemorrhoids, either to be vascular inflammation and ischemia of the mucosa and the vessels, leading to prolapse. The parasympathetic neurotransmitter and endothelial-derived relaxing factor also have a matter regarding the etiology of the hemorrhoids. Failure of intrinsic vascular sphincter mechanism of tonica media of submucosal plexus. Here we have anorectal pain or irritation regarding the prolapse when we have increased internal anal sphincter pressure. So if you are defecating, there will be protrusion of these vials or these hemorrhoids, and when there is increase in internal anal sphincter pressure, will be difficult to be retained back inside the anal canal when you are finishing the defecation. And this is the mechanism regarding the points of hemorrhoids. If you look for erectile function, will have the same idea in a different manner. Etiology of hemorrhoid disease, so we said the first one, we have vascular inflammation and ischemia, wrote by Morgado. There is a severe inflammation and ischemia of the mucosa and the vascular thrombosis, leading to a mucosa to be prolapsed. And this is an evidence that increased internal sphincter pressure will lead also to develop the hemorrhoids in a patient without any thickness, because sometimes we have a condition called anal fissure. Anal fissure will cause a hypertrophy of internal sphincter and will be a thickness of internal sphincter and will be elicited by examination with difficult to index to introduce your finger inside the bottom of your patient. But here in hemorrhoids, there's no thickness, that لكن في عندك increase in the anal cone. And that's why it is difficult to retain back inside the anal canal once they are protruded to outside. The vascular smooth muscle, we said, there is parasympathetic neurotransmitters which supply that area of the anal cushions and internal biles. Also, the endothelium in that area. Increase the endothelium, as we know, there is two factors here, relaxing factors and constricting factors. The same with erection in a male. Relaxing factors to produce the erection and constricting by the help of external sphincter to keep the erection. Here the same thing. If you have a deficient and there's disturbance between the relaxing factor and constricting factor, so we'll have the protrusion of the bites and increase the size without shrinking to inside. And this is the mechanism regarding the effect of the neurotransmitter and the endothelium-derived factor regarding the relaxing factor more than constricting factor. So we understand mainly what's the etiology of hemorrhoids in a male patient. Here another thing we are calling the uncoordination between the drainage and between the filling and drainage of anal venous plexus. The same thing with erection. If you have a defect between filling and the drainage, we'll have the erectile dysfunction. We are the same thing. If you are filling the biles and the plexus, internal plexus, without drainage completely to inside, that will develop hemorrhoids. And the mechanism here is well known by Asia, and that is failure regarding the tonica media and the smooth muscle. It contains تقريبا 5 to 15 layers. And there is this sphincter, like an internal sphincter inside the smooth muscle of the internal plexus. If we have defect in this internal structure, will be a filling without drainage and will be containing hemorrhoids in the patient. So it is enough to understand that the hemorrhoids either to be abnormality in the vasculature of the anal cushions and the hemorrhoids with some sort of internal failure of intrinsic vascular filling and drainage. Here regarding erection, we have know the physiological process of erection. It depends on vasodilatation of the vascular bed of sinuses of Tocarbora cavernosa, which run through the venous to increase the blood flow because of the relaxation of the smooth muscle of the corpus cavernosa, causing the erection. And by maintaining by the tonicae, the fibrous elastic sheath, when they're constricting, they will prevent the drainage of that sinuses blood, so the air to keep the erection and prevent the blood from draining away from the penis. And this is the physiological thing of erection. Here the same slide as we said before, the hemorrhoids associated with either to be vascular abnormality or anorectal pain or irritation regarding the internal sphincter pressure. The same thing here, erectile dysfunction also a result of vasculogenic or neurogenic or hormonal or psychogenic factor or disturbance in nitric oxide with CGMB pathway, which is well known for you regarding the mechanism of either a problem in relaxation factor or constricting factor. And there's a benign soft tissue cell depends completely on these two things to initiate the relaxation, then constriction to prevent the drainage of the blood away from the penis. Erectile dysfunction, the neurotransmitter, the same thing here for parasympathetic and endothelium of corpus cavernosa regarding the relaxing factor and constricting factor. Nitrous oxide causes intrinsic or intracellular activation of soluble adenylyl cyclase, which regulates the intracellular cyclic cGMP that increase the concentration of it inside and the aim to decrease the concentration of calcium. And you know that decrease intracellular calcium will prevent the actin and myosin from cross-link and contraction. So the relaxation, it will be the eminent thing regarding the point. Here, as we know, and this is for you very easy to know, that erection, these two things, either to be in the central or in the peripheral. And we have in both of them, in central and peripheral initiators, we have either to be initiator or conditioner. As testosterone as conditioner for the central, and prostaglandins E2 and others will be a peripheral initiators. And the aim here to do smooth muscle relaxation and decrease the intracellular calcium. And this is process will be mainly by relaxing factor. So our patient will be assessed in our two things that we are complaining of, either to be 3rd, 3rd, or 4th degree piles with erectile dysfunction. As we know, the presenting symptoms either to be bleeding, pain, swelling, soreness, itching, mucus discharge, increasing in the vascular tone regarding the internal sphincter, and the majority of our patients reported erectile dysfunction as a sign of hemorrhoid, seeking surgical treatment for both conditions. So we assess our patients for erectile dysfunction depending on international index of erectile function questionnaire, depends on 5 questions and 3 and 5 in 5 domains, either erectile function, organism function, sexual desire, intercourse satisfaction, and overall satisfaction. Each domain is a matter of 5 scores. The total score will be 25 points. So our patient characteristic and study design, prospective study of 600 male patients, Yemeni patients, male, the main age 39 years, divided in 2 groups, 300 for each one. The test group, group 1, having hemorrhoids and erectile dysfunction, selected for surgery hemorrhoidectomy. The control group, having hemorrhoids and erectile dysfunction, selected for non-surgical treatment. 136 patients were excluded from the first group. Also, we have 140 patients were excluded from the second group. 164 remnant patients were remained for first group for hemorrhoidectomy. And 160, we remained them for the second group as control group. The characteristic for exclusion of the majority of these patients, either to be arteriovenous malformation, male with organic erectile dysfunction taking any medication for erectile dysfunction, or patient with 1st and 2nd degree hemorrhoids with or without erectile dysfunction, anticoagulated patients, portal hypertension patients, recurrent hemorrhoids, and after surgery, that's mean, and age below the 18 years and above 50 years. We have signed informed consent for was obtained from all patients and all participants before proceeding for our treatment, or patient physically assigned for hemorrhoids and erectile dysfunction by history taking, general genital and rectal examination international by assessment international index erectile function عفوا اللي هي بيعتمد على ال5 الأسئلة الرئيسية اللي هي الموجودة عندنا، وكل سؤال عنده 5 scores either very low هي رقم 1 low, moderate, high and severe, and all this one if you calculate 5 by 5 will be 25 points. And we categorize our patients either to be in absence of erectile dysfunction if the score to 21 to 25, or mild 16 to 20, moderate and severe. Our symptoms, our criteria of our symptoms, our patients, median age is 39, control the same تقريبا, non-significant, no change, and no difference between the 2 groups, our hemorrhoidectomy group and our control group. In all the parameters regarding the grades, regarding the body mass index, regarding the smoker status, regarding the hypertension, hyperlipidemia, diabetes mellitus, and cardiovascular disease. Preoperative symptomatology will be for the surgical group and for control group. Also here, this is the international index for erectile function. Preoperatively, the two groups non-significant because they are merely the same, so they are matching each other before the surgery. The technique that we use for hemorrhoidectomy called modified St. Mark's open hemorrhoidectomy. We have different types of hemorrhoidectomy by laser, by BBH, alias stapler technique, a lot of techniques, rare techniques, radio أو نسميها recto anal repair, كلها excluded. Just an open technique, open hemorrhoidectomy by excision using the cautery, monopolar cautery. The technique depends on the skin bridge arrangement, remove associated external element, pressure, or preserve. This is the technique regarding the point, and mainly it's important for just for surgery, not for urology here. It was a day case surgery using different things here regarding the intraoperative, postoperative.
Dr. Waheeb.
Give me 2 minutes just.
5.
Okay. All patients were done by the same surgeon, well contact number, and the follow-up for 1, 3, and 6 months. And outcomes regarding the point, the most important we are talking here for erectile dysfunction regarding the international index, regarding the points of complication and healing. It's not a matter here. And here, a complication happened in our patients regarding the postoperative complication. And here, the most important thing regarding how to compare the two groups before surgery and after surgery. We have here a p-value at the right side. All it is significant. So there is improvement between baseline before surgery from 15.5 over 25 score to 23 in 6 months and 21.3 in 3 months in all or the domains of international index of erectile function. So results, حوالي 103 patients to 62 patient 0.8 having hemorrhoidectomy have significant showed improvement in erectile function at 3 and 6 months, compared only with 5% in a control group. So if hemorrhoids are associated with regional vascular and rectal pain, both will increase the risk of erectile dysfunction. Hemorrhoids and erectile function share pelvis, muscles, nerves, and vessels, and localized effect of swelling of varicosity of the hemorrhoids in the anal canal will affect the erectile function. Hemorrhoid shaped pelvis. Also, we are known that hemorrhoidectomy controls the local disturbance of genital area and pelvic region, leading to control the shared one. That's mean in a matter of erectile dysfunction. So I have باقي معنا تقريبا شريحتين. Limitation of our study. طبعا firstly there's a cross-sectional survey study, so it's difficult to establish the exact cause of the significant association. Secondary, we didn't expand our investigation to have hormonal neurological tests and involving you as urologist and there and new points of view regarding the shared problem. At the end, yes, it is a painful procedure, but at the end, we have a value that if you have a hemorrhoids, it is most probably will have also erectile dysfunction. And if you have lucky to have hemorrhoidectomy, so will improve your erectile function later on. So in conclusion, we concluded that surgical hemorrhoidectomy is clearly related to improvement of erectile function in Yemeni male patients having hemorrhoids with erectile dysfunction. Thank you very much. بس لو تقولوا لنا هذه بس المسج الأخيرة. آخر حاجة هذه بس. قاليها آخر صراحة. آخر شيء. أما أنا بس البيانيست عملها فالدمير قال to play the piano you need brain, heart and means. Without brains you are a fiasco يعني فاشل. Without means you are an amateur, and without heart will be a machine like surgery. Thank you very much.
شكرا دكتور.